It's Suicide Prevention Week, but supporting mental health is a year-round commitment for us here at CBS 8. We're working for you on this because you matter. All this week on the floor and throughout the month, we'll be sharing important resources that are available. One of them is the Stephen A. Cohen Military Family Clinic. Here now with more on how it's supporting our military community is Clinic Director Kelly Williams. Kelly, thanks for being with us here today.
Thank you for inviting me.
Pleasure to have you. First off, I want to tell people, who are you? What do you do? The Cohen Veterans Network.
Right. So I'm the clinic director at the Stephen A. Cohen Military Family Clinic and VVSD in San Diego. So we are a series of 24 clinics around the U.S. that provides mental health care for veterans, active duty members, and their family.
When we say VVSD, that you're based at Veterans Village, San Diego, is that what that is?
Correct. We are connected to Veterans Village, San Diego.
Okay, so this is such an incredibly sensitive topic. We're talking about it all this week. We've talked about how to reach different people who are going through crisis. 17 members in the military or veterans take their own life every day, we're told. How can the Cohen Network help them out?
Yes, it is a very important time. That's why it's this month of suicide prevention is really important. Our clinic in particular provides those mental health services. So if someone's having those thoughts of wanting to harm themselves, or if they're concerned about a family member who's wanting to harm themselves, they can come get care.
Are you finding that people who know that they need help are finding it easier to reach you and reach care these days? Are we getting the message out that there are resources to people who are open to that thought?
I think we are definitely getting the message out that we have therapy, we have services available. I feel like mental health has definitely picked up as far as people's willingness to get help, but we can definitely do better and we can still reach out to more people. Is
there still really a heavy stigma for people, especially in the military, people who are trained to be tough, to be fighters? Is it still difficult for people who are trained that way to overcome that, to say, I'm in need, I'm vulnerable right now?
At our clinic in particular, I think we do probably better breaking through those barriers because we really focus on having military competent care. So all of our clinicians are either veterans themselves or they've gone through really great training so that the veteran or active duty member can feel comfortable, so that there's maybe a little bit less stigma because they feel like their clinician really knows what they're dealing with.
And do friends and families, do enough of them know that they should be looking out for these things too, and maybe that they can reach out for help to learn how to support these military veterans and military members and veterans, excuse me?
I'm so glad you brought up the friends and family because I think that's one of the biggest misconceptions. I think often we focus on that person individually who might be thinking about taking their life or someone who's passed on from suicide, but there's really a ripple effect that hits the whole family. And so this month our Cohen Network is doing actually a campaign of #ReverseTheRipple. And so we're focusing on providing resources for people to focus on preventing suicide instead of just that reactionary thing that I think we tend to do.
It's a scary thing to do. It's a difficult thing to approach when you're worried about a loved one. Are there any tips you have for people or resources you could direct them to if they're worried about a loved one?
Yes, so our campaign if you go to cohenveterandsnetwork.org/suicide prevention, we have a lot of great resources on there. We have a quiz, we have a Q&A. I actually took the quiz about frequent misconceptions on suicide. And there's another area that I really like where we talk about the coded messaging, where it breaks it down to even social media posts that you might see and might make you wonder, like, is this something I should be worried about? So it really talks about things to look forward in your family.
We're going to put websites up to give people that information where they can reach out for help, at least for the Cohen Veterans Network. Kelly Williams, thank you so much for your time today and for what you're doing for our military members and our veterans as well, and all their families. Again, there are the websites, cohenveteransnetwork.org. We also have our stories this month at cbs8.com. You matter. And remember, the 988 Suicide and Crisis Lifeline, key for so many people. Kelly, thanks for your time.
Thank you. I would also add, if you dial 1, that is a veteran-specific resource on that 988.
988 for veteran-specific. I did not know that. I'm sure many of our viewers didn't either. Thank you for that.
Thank you.